Welcome to the Joe Cohen Show. Join me as I share my experience with biohacking and invite top health experts to explore the latest technology, supplements, research, and resources for optimizing your body and brain. Hey everyone, I'm really excited to bring on Dr. Alan Bauman, who is a full-time board-certified hair restoration physician who has treated over 33,000 patients. He's performed over 12,000 hair transplant procedures and over 12,000 PRPs since starting his medical hair loss practice, Bauman Medical, in 1997. He has gone through a lot of different treatments. He's pioneered a lot of treatments, including PRP, low-level laser therapy, and a bunch of other really cool and interesting treatments that we will go through today on the podcast. I have a lot of questions about hair loss, how to prevent it, because it's in my family and it's a topic of interest to me. So hopefully we can do I want to try to get through as many questions as possible. So I'm going to try to rapid fire some questions. Okay, so one of the things that I've been curious about, and just I guess we could start off here. So first of all, thank you for coming on.
Yeah, thanks, Joe. It's really a pleasure to be with you. I'm excited to be here.
Yeah. So PRP is something you've done 12,000 PRPs, and I've done one because I do everything and like to try everything out. But when I look at the cost benefit equation of sticking these needles, first of all, it's painful and you have to keep on redoing it. So is PRP still something you think is like, where does PRP fit in? How does somebody know if they should be doing PRP versus other treatment? I guess that's the best question.
Yeah, and that's a great question because PRP, platelet-rich plasma, is a very powerful regenerative treatment. It's used in orthopedics, it's used in skincare, and of course in hair restoration for almost 2 decades now. Gosh, you had a PRP and it was painful? That tells us a lot about how that how that treatment was applied to you. And we can go into some great detail why PRP should be applied painlessly. And I'm sorry that happened to you, but PRP, platelet-rich plasma, is the workhorse of regenerative medicine. So you remember years ago, professional athletes used to have, let's say, an injury in their ankle or Achilles tendon or their knee. Many patients like that, many professional athletes like that, flew across the world to places like Germany and France and Italy to get platelet-rich plasma. Why did they do that? Over 20 years ago, we didn't really have orthopedic surgeons that embraced regenerative medicine like we do today. Those kinds of treatments are certainly available now down the block, hopefully at your local orthopedic surgeon's office if you have an injury or trauma to those areas. But let's talk about PRP for hair loss. First of all, it's important for your listeners to know that PRP, platelet-rich plasma, think of it more like a fertilizer into the garden, right? And we're all just scalp farmers here, right? We want to get the best possible regrowth and growth from existing hairs up on the scalp. And so we apply a variety of therapies and treatments in order to do that. PRP is a very powerful treatment, or it can be. But what we've learned over the years is that you have to dial in the correct number or concentration of platelets in order to get the effect. Just backing up for a moment, platelets contain growth factors and other chemical messages that, when released, stimulate wound healing. That's why when you cut yourself with a paper cut or something like that, platelets rush in, clot the blood, start the healing phase. They message the local blood vessels. They message the local fibroblasts to create the healing. They modulate inflammation. So platelets have a big function in tissue regeneration and repair. Many of those same growth factors have a powerful impact on hair follicle cycling. And what we've learned over the past 15 years in the examination of a hair follicle is that it's like, think of it like a car that you want to hot wire. You want to steal a car. You got to know what wires to click together in order to get the engine to turn on and get moving along. Knowing the growth factors now, today, that stimulate hair growth and mitigate hair loss and so forth, we now know platelet-rich plasma contains these growth factors which stimulate the hair follicle directly. So let's talk about the application. Gosh, again, my apologies if you went to a clinic and they applied a painful PRP for you. That's terrible. And that, first of all, it should never happen. Creature comforts and patient comfort here in my office at Bauman Medical is a priority. And the reason why I think it's important, number one, if we apply a painful treatment, I think that you are unlikely to come back. And that's what you insinuated. Well, I don't know if it's worth it, doc. Why should I do this? So if we were able to apply a treatment that works and was comfortable, you'd be more likely to be adherent to that regimen for sure. The other reason is more physiologic. Today, we know that inside the hair follicle, there's actually a stress response pathway, like the HPA axis in our body when we stress and cortisol and so forth, affecting the brain and affecting our body. There's actually those same chemical pathways in each and every follicle. So if you're causing stress at the level of the scalp, you could actually be doing more harm than good. And that's why we want to apply treatments to the scalp in a very careful way. So PRP in the office, we take a small blood sample, we test it in a counter to see what the platelet concentration is. We spin it in a very special way. We use a dual spin process to extract the platelets at high density, so high concentration. We also want to preserve the monocyte population, which is important. So if you went to a clinic like your Medi Spa down the block or some plastic surgeon's office or some untrained hair guy, maybe they use a little test tube with a gel separator or a salad spinner on the desktop or something to separate the blood. That's not going to give you a high concentration of platelets. And it's certainly not going to preserve the monocytes, which are critically important for hair regrowth and for tissue regeneration and repair. So the other thing that's going to happen when you come into the office is we apply a local anesthetic block so it's completely numb before we do anything to your scalp. And we do that in a very special way so that you don't feel the local anesthetic going in. It's a combination of vibration and maybe even some laughing gas, nitrous oxide, things like that to keep you super comfortable during that process. And then obviously we want to be applying the PRP in the correct area. So if you have a big bald spot, that's not the right place to put the fertilizer in the garden. You have to apply the fertilizer in the garden to the areas that are weak but not dead, and the areas that you want to protect that are not yet weak but are at risk. And some of that is determined by AI-powered microscopes. Some of it's a clinical judgment, but every examination is critical before we even apply a therapy or treatment. So why would you want to do PRP? In my clinic, we've designed a way to apply it only once a year. So you don't need a series of these treatments. You don't have to come in every month or 3 or 4 months in a row. Do it once a year. And we document it time and time again in thousands of patients that on average, a boost will last for about 10 to 14 months before it starts to wear off. And the reason why you'd want to do a PRP, maybe either in conjunction with your current regimen or as a standalone treatment, is that it's non-chemical. So there's no pharmaceutical application daily of medications, either orally or topically when you're doing PRP, although that might help. You don't have to do any other action. You could use the PRP as a standalone treatment. And of course, everybody could respond differently to that, depending on the hair density and the quality and so forth, and the stage of hair loss. But PRP works better in a younger population, a little bit better, just like it does in orthopedics, where your stem cells can respond better. You can also expect that PRP will work better in the earlier stages of hair loss. So for a lot of our patients who have a busy lifestyle, maybe college students, things like that, or already seeing a receding hairline, getting in the crown, PRP once a year is a great summertime thing. They come in, bada bing, get the treatment done, and we document the results using hair measurement. So I know that was a long answer to a short question,
Yeah,
but that's the reasons
I think
why.
yeah, I think that takes care of some of the objections in terms of, the pain. You're saying, well, it's not actually supposed to have pain. So you go to the right person, you won't have pain. And then in terms of the frequency, you're saying you have a special method to do it once a year instead of every 3 to 4 months as other clinics advertise.
Correct.
Yeah.
Absolutely correct.
Okay, so that's actually quite useful. Now, I guess the question is, let's say somebody is working better in these early stages, and my question would be, okay, somebody's going to pick PRP versus, or maybe in addition to, but why wouldn't somebody just, let's say, do some Minoxidil, some topical Finasteride, and some topical thing, let's say, right? Is there an additional benefit to the PRP that wouldn't be captured by these things?
100%. Many patients come in and they have used either over-the-counter minoxidil or something more sophisticated like a Formula 82M, which is a compounded product. Or maybe they've tried oral finasteride and they've had some issues or side effects or fear of that. And they've gone, as you said, to a topical finasteride or a combination. But many patients find that they want something a little bit easier, a little bit simpler, and they may not necessarily want to use medications over time. And so PRP plus other therapies like red light therapy, low level laser, nutritional supplementation, some minor changes in lifestyle and stress mitigation can be helpful. But remember that PRP is not redundant to those therapies. Minoxidil has a very strong and well-known mechanism of action. It's going to turn those follicles on and keep them on. And it does it through a chemical reaction. That's not the same reaction as PRP. Finasteride lowers DHT, which is dihydrotestosterone. That's the main trigger for male pattern hair loss, for example, in the body, and sometimes in women as well. And when you're talking about therapies or treatments, these are non-redundant and often synergistic there. So it's not like you're going to give up the sit-ups and do the push-ups, and you're going to do all of the above if you want a better result. But everybody comes to it differently. Some people start with the medications and then they add the PRP. Some people are doing the PRP and then they maybe add the medications or
Right.
laser or whatever therapy.
What would you say compared to PRP? There was another therapy that I did that was like stem cells. They took some follicles from your scalp. It wasn't exactly stem cells. I forgot the exact name of it, but they spun it in some centrifuge or whatever, and then they injected more of it into your scalp. Do you know what the name of that is?
Yeah, so I think maybe what you're talking about is the use of hair follicle stem cells as an extracellular matrix or a biologic scaffold using a technique called Regenera. And
Yeah,
Regenera is something I'm
that's what it
very
was.
familiar with. We heard about it many years ago in Italy. They're using it extensively and also in the Middle East, actually, to be honest. And we have used that in conjunction with transplants, just like with PRP. You can actually mix and so what you do during a regenerative treatment is you take a small biopsy of the scalp, if it's a standalone treatment, hopefully in an area that's not noticeable. And if unfortunately, if it's a big enough biopsy, you might need a stitch, but usually we use a very small instrument to take the biopsies, take the follicle. Those follicles are then disaggregated, which basically means chopped up in a machine. And so that machine is a very sophisticated micronizing process. So it's a specifically sterile cartridge with a filter and a very specific way that it works to disaggregate that tissue. Just for example, if you were going to have a bone graft, let's say they take a little bit of bone from here and they're going to put it over there or cartilage or what have you, during the surgery, an orthopedic surgeon will take a piece of bone from one location, essentially grind it up and then add it to another location as a graft, right?
Yeah.
And
By the
think
way,
of it
this is exactly the treatment that I did. But yeah, so
oh, great,
continue.
perfect.
Yeah.
Excellent. So Regenera is that treatment for hair. So we take that small biopsy, we put it in the machine, and what we get is a liquefied product that actually is flowable, meaning that the pieces are so small, they go through like a micron level screen or filter, if you will. And then that gets injected into the scalp. Now, the way that we do it is that we actually mix that with the PRP. We
Mm,
use the PRP as the vehicle for that stem cell treatment. And so that regenerative treatment is hair follicle stem cells that are being mixed with the PRP as well as the other tissue and injected back into the scalp. And it's actually a very powerful treatment. We've used it on quite a number of patients in conjunction with the transplants as a standalone therapy. And the good news is when you do it with the transplant, Joe, you don't have to do any kind of extra biopsy work. Obviously, you just take a couple of the hair follicles from the harvest and then apply that into the machine to create the liquefied portion of the stem cell treatment.
okay.
But there are
So
other therapies. Yeah, there are other therapies that you could do if you're like as a standalone treatment in the office. If you're like, let's say you're afraid of needles and you don't even want a blood draw, you could do a treatment like transepidermal delivery. That's great new technology that is a very comfortable, relaxing, no needle, and as we say, no trauma, no drama procedure. Very relaxing thing in the office. Have you ever heard of that?
okay. No, I haven't. That's probably something I'm gonna explore next. Ted, actually, let's take all these things into account here. So, I've actually done a hair transplant, FUE. I think it's the FUE is which
The
one?
most
Is it?
minimally invasive style of hair transplantation.
Yeah, so that's the one I did. Yeah, it was FUE, and then
I'm sure you know from my biography, but your listeners may not, that I was one of the pioneers of FUE in the early 2000s. I was one of a handful of physicians, probably less than a half a dozen, who really pushed it forward and did over 10,000 hours of work on that technique before it became popular worldwide.
oh, that's great. That is very interesting to know. Anyway, yeah, so I've done that technique, and by the
Nice.
way, I think I actually did it with 2 different doctors. The first doctor was horrible, so I do highly recommend going to somebody good for that, and I'm assuming if you pioneered it, do you still do those procedures?
FUE certainly is our
Yeah.
workhorse for hair
Okay.
transplantation. I have not done a linear harvest in over 15 years. Of course, most of us who are full-time board certified surgeons who have been in practice more than 25 years, we're all trained in linear or strip harvesting. That's what was available back in the 1990s. But as I said, somewhere in the mid 2000s, that's when we started to develop the FUE process. It wasn't simple. It was not easy. It was certainly not efficient. I'm credited for having brought the first manual FUE instrument to the market. It was called the Bauman Mindex. It was certainly not a big winner, but it was something that we wanted to bring to the market for surgeons to help extract these hair follicles. And of course, later on, then we had more mechanical devices, and then we had robotic devices. And now we're back to these other smaller manual handheld mechanical devices with some suction and so forth to help us get the follicles out without a scar, that's linear, without any kind of stitches or staples, and with a lot less downtime and a lot less discomfort, honestly.
Oh, that's great. So these things keep on getting better. But so
Oh,
let's
yeah.
take into account all these kinds of procedures. We've got the FUE, which is the gold standard for hair transplants. That's the most common one, the one that works best. Then you have the Regenera, the stem cell one. Then you have the PRP, and then you got the TED. And what you're saying is you like to combine a lot of these together, right?
Absolutely. Even
But
if
where
you
where
step
where
back,
does like
look,
where does the TED fit into this? Let's say somebody does a Regenera. I'm assuming when you combine these things together, they're also the costs are also going up quite a lot when you combine 4 different treatments, right?
here's the thing. Obviously, nobody joins a gym and does every exercise and every machine on the first day. Let's just back up a little bit. Before you jump into a gym with a trainer or without, you've got to figure out what are your goals? What are you trying to accomplish? And that's where the evaluation really starts to kick in. And so when someone connects with me, either virtually, as we're doing today on a video call, or in person in the office, we dissect into what is the medical history? What is the hair loss history? What are the lifestyle risk factors that are affecting the hair follicle? Do we need to do any kind of testing like DNA testing to look at metabolic pathways that might be affecting the hair? Are you nutritionally deficient? Are you lacking sleep? Are you totally stressed out? Before you embark on a hair restoration journey, you've got to really take a step back and look at the whole picture. I love talking about the technology, regenerative medicine, and TED, and growth factors and peptides. Those are awesome. But if you don't take care of, for example, just the soil in the garden, right? If you have itchy, inflamed scalp, all of these treatments, none of these treatments are going to work that well. And so let's
Right.
get down to the business of figuring out what are the risk factors that are affecting your hair. If you're a middle-aged woman and you're going through hormonal changes, perimenopause or menopause, you may be noticing some changes in your skin and your hair, in the hair texture, hair color, hair curl. Even just the quality of your hair might be changing. You might be noticing that your eyebrows are changing with time. Is that indicative of a hormonal imbalance? We got to go from the big view first, that 10,000-foot view, and then get down into, okay, what kind of measurements and tools are we going to use to evaluate your situation? We're going to click a photo with an AI powered microscope to look at the back of the scalp versus the front or the thinning zone. We want to get an idea of what you're noticing. Are you noticing excessive shedding? Or is it a receding hairline? Or is it a bald spot that's growing? Obviously, if you needed a hair transplant, we don't start off with some biotin. We're talking about restoring some hair into that area, but you still have to protect the other hair. And so I'm sure your surgeon recommended to you, look, the transplanted hair is permanent, but your other hair is not. And so that's how we build the treatment. Some patients like the idea, and you asked specifically TED versus PRP. As we said, PRP is local anesthetic. It's a blood draw. It's once a year. Powerful. We're 13,000 TED treatment or PRP treatment complete. TED is relatively new. Even though the technology has been available, this is something that came out only about 3 or 4 years ago. And so we don't have double blind randomized clinical
Mm.
trials. We have a few pilot studies. But patients like the idea of not having to be stuck with a needle. And so that's where the TED comes into play. Also, TED requires 4 treatments, once a month for 4 months. So that's a repetitive treatment. Now, you either got to fly in for that or you got to be down the block or not far away from us here in Boca to have that kind of treatment typically. So those are risks and benefits and costs and benefits, if you will, of the various therapies and treatments. But
What about Regenera versus PRP? If you had to pick one, which one would it be?
so Regenera is, in my hands, Regenera is a PRP treatment, right? Because as I said,
Ah,
PRP is the vehicle that we use to apply
mm,
the Regenera. We don't just apply Regenera in a little bit of saline. That makes no sense to me. Let's put the Regenera in the powerful PRP process. And the reason why this is important, and I think maybe some of my colleagues are a little bit behind on the technology of regenerative medicine. I've been a part of regenerative medicine in that field for a long time. In fact, I was literally in the first class of certification in the American Academy of Anti-Aging when they did a stem cell fellowship. I was in the first class the first year they did it. I think it was 2009. But the point is that in the world of regenerative medicine, you have cells, signals, and scaffold. And so everything that we do in the world of regenerative medicine falls into one of those three categories or more, right? So, for example, PRP, platelet rich plasma, the platelets are the cells, the signals are the growth factors that are released, but where's the scaffold portion? And so, what we've learned is that using a scaffold is something either biologic or synthetic that you can combine with the PRP, you get a stronger, longer effect. And so that's where the Regenera comes in. The Regenera not just gives you some stem cells from the hair follicle, but it also gives you this biologic material that the scalp and the hair follicles are going to work with. And so that's the scaffold part of it. And very often we'll use perinatal biologics. So it could be placental tissue, Morton's jelly from umbilical cord. Years and years ago, we used to use pork bladder, believe it or not. That was called A-cell. And there's still some of my colleagues using A-cell out there. It was a great healing treatment. But I guess the point is that those types of things need to all work together to get the best possible result in a regenerative medicine treatment. Same goes true for whether you're doing in orthopedics or in skin. For many years, we used to do a small lipoaspirate, which is basically a mini liposuction to get the fat cells to create a stem cell therapy for hair regrowth. So that could also be
yeah,
in that mix.
I got you. Okay, that makes sense. I want to present my, dilettante research on hair loss and see if you have
Sure.
any feedback on that because I use those basics to then guide in how I can cover all these bases to prevent hair loss. And this is pretty off the cuff, so let's see how I do on it. But basically, as I understand it, hair loss is from a lack of ATP, so energy production in the scalp, right? It's a lack of blood flow, so it could be oxygen or nutrients, a lack of growth factors, DHT, and DHT could cause some of these issues here, but it could also be independent. And then, so there's, and then like inflammation and oxidative stress, essentially. Is there anything else that I think? So,
Well,
is there anything else besides that?
yeah,
Or are
I
we
mean, I
correct?
really would. I think maybe we need to do something a little bit different. What I would suggest, and certainly increasing blood flow and enhancing cellular metabolism and increasing ATP production are all methods to improve hair growth. I wouldn't say necessarily that patients with male pattern hair loss have poor blood flow because having operated on tens of thousands of patients, I can say that's not the case. They do bleed, and sometimes a lot, to be honest. And so we have to take particular care and do particular types of treatments to actually minimize the oozing and the bleeding if you want a successful hair transplant. So
Mhm.
I think I would approach it a little bit differently. I would look at the genetic risks first. Male or female pattern hair loss runs through the families. Let's look at your family tree. If you're not going to do a DNA analysis right away, let's look at the family tree then and see who's out there with hair loss. The biologic relatives on mom's side or dad's side could have an influence. And we know for male pattern hair loss, DHT, dihydrotestosterone, which is made from testosterone, is the primary trigger. How do we know that? We know that because if you lower DHT through pharmaceutical intervention, you can basically stop the progression of hair loss like 9 out of 10 times. That's a pretty good rate of success. Now, some people do have sexual side effects from doing that, but again, it's only probably less than 2% of patients, and those are mild and reversible if they occur. Now, the other modalities or the other metabolic pathways that you mentioned, like ATP production, certainly mitochondrial dysfunction is really critical as we continue to age because we know that hair can change. Even the more permanent hair on the sides and the back of the scalp can change color, it can change texture, and it can change in caliber as we enter into our older years. And so, is it cellular senescence, which can be hopefully mitigated by a number of different factors? Is it energy production like ATP? Certainly, if we apply treatments, for example, like photobiomodulation or what we used to call low level laser light therapy, red light therapy, we can increase ATP production in the scalp, and that will help hair growth. I think you're on the right track. I just would flip it around and look at those primary causes first, and then apply those pathways that you mentioned in categorizing treatment modalities.
Okay, so I guess I
Does that make
assume
sense?
that if the treatment worked, then that was probably the cause of the issue. You see what I'm saying?
Look, you can have a young guy who's got male pattern hair loss, and his mitochondria are fine, potentially. Let's say he's in his 20s, unless he's got some other kind of really strictly disease going on. And you apply red light therapy. It's not that he was mitochondrially deficient or ATP deficient. You just now put a turbo boost into that engine.
It also could be some other mechanism for why the laser therapy doesn't work for everybody. So it could be that these individuals who it doesn't work for, they had a different mechanism by which laser therapy is not the best approach.
Yeah. No, that's true. You could say that about just about any kind of therapy. Usually I find the patients that have the toughest time with either topical medications or laser light therapy, and they come in and they say, oh, I tried this or that, it didn't work. Then the next question is, what exactly did you try? And then some patients will say, I used over the counter Rogaine, or I bought this laser on Amazon. It was like a band or something, or some big old helmet that was plastic looking thing from China. And then we start to dig down into it, and they bring it in, and the thing is just like a hunk of junk. And they bought it for $600 or $800 or less $1,800, something like that. And to be honest, a true medical grade device for hair regrowth is going to be 3,000 to 5,000. So it is pricey to get a good quality device. But if you bought a $600 laser and you wonder why it didn't work, let's think about that for a minute. Same thing with
Why?
over the counter Rogaine.
What is better about these medical devices? Is it more powerful, or what is it specifically about these more expensive devices?
Yeah. So a few different things, right? So when you look at a underpowered laser device, that could mean that the lasers themselves aren't giving out as much energy. Like the quality of the diode is really critical. And I actually have in my desk drawer right here, just arm's length away, a device that measures how much power output the laser is providing. And so
Mm.
for many years, like when I would go to conferences and I see laser light devices all over the place, I'll put that sensor right on it. And I can tell them, hey, man, this is like 1 milliwatt. This is 5 milliwatts. This is 25 milliwatts. And those vendors didn't really like me. But if I'm going to buy a laser, I want to make sure there's got some horsepower in it. And so
Okay.
it's not just the amount of output per laser, okay, but what is being put out. And so some people have sold lasers, unfortunately, which actually were not actually laser devices. They were just LEDs.
Yeah, I
So,
got one of
like,
these China devices.
let's put the measurement tool on it and figure it out. Let's put the sensor on it
Okay.
and see what's actually coming. But no, so I could see immediately that device, that's not a laser. A
Okay.
laser is like a round item, right? So this is what lasers look like.
Okay.
So
I
this
see.
device has over 300 lasers in it.
Uh-huh.
And obviously it folds up. It's flat, but you fold it up and you can put it right on your scalp like that.
I see.
And
Okay.
so the point is that each one of those lasers puts out a lot more power than an LED. It has a certain direction to it. It's coherent light. So it's not like the difference between, let's say, using a flashlight and a laser pointer, right? Big
Mhm.
difference. And then
This
also
is
the
more like
amount.
a laser pointer or?
Yeah. A
Okay.
laser pointer is a focused beam of light. It has a lot of power in that one little beam. You can buy laser pointers that will pop a balloon easily.
Okay.
But that's how much energy those laser pointers have. And don't shine it in your eye. Okay. But the point is that many of these underpowered lasers are cheap knockoffs, and they're being sold as hair growth devices, and they're not even FDA cleared, perhaps. They're just shuttled into Amazon, and people buy them thinking they're getting, oh, I'm trying a laser.
Would
It's
they
like,
do
that's like
anything, or it's just not as powerful?
it might do something. These devices are never devised or engineered by optical physicists like the devices that we use, and we
Right.
tune the treatment time. We know 5 minutes, you're going to get a full treatment in 5 minutes. Why? Because of the power of the device. Maybe those
Mm.
devices that are being sold on Amazon would work, but you'd have to wear the darn thing for an hour. It's not a joke.
Right.
In the
Right.
early days
And
of
that's what I
laser,
do.
I
I
mean,
wear it for 45 minutes.
yeah. And so how
Okay.
much of that laser energy is getting to the skin and over what area? Like the laser I just showed you, it treats all the way from the nape of the neck to the
Mm.
hairline. And so that's
Okay.
important too. You want to hit those blood vessels down there in the occipital zone to really engorge them and to get more blood flow to the scalp. Those are really big vessels typically in the back of the scalp. So you'd want to hit those with laser pretty hard if you're going to try to
Right.
increase blood flow.
I
So
I
those are some
wonder
of the things.
yeah. Yeah, I wonder if is it the actual cost of putting in all these dye or lasers into the hat? Meaning, I understand these cheap knockoff things from China is, I don't know, $70. It's very cheap.
Oh
But
my
like,
God. That's great.
yeah, really cheap. So I'm just, and I actually feel something on my head, meaning I actually feel some cognitive changes from it. So I think
Oh,
it's
well,
more
yeah,
from what's in the prefrontal cortex, but what's hitting here rather than,
well,
I
red
don't know
light.
how much. Yeah.
Yeah. Red light honestly should not
Oh, this one itself has also
penetrate.
infrared.
Okay. So
Yeah.
yeah, if you got like a longer wavelength, you can actually do some deep penetration. We use photobiomodulation devices in the 501(c)(3) that takes care of military veterans that I'm a medical director for to treat TBI, traumatic brain injury. And there's a lot of good research out there, not to get off topic, but a lot of good research on stroke victims and people who have had brain dysfunction and using photobiomodulation to enhance blood flow to the brain and cognitive function. I've used it myself. And there was a time where I came back from a conference. I was ready to do a workout and I just felt like totally, weak and de-energized. And I put that German Weber brain helmet on and man, about a 20-minute treatment totally woke me up and basically kept me up for about 6 hours, disrupted my sleep. So I know that those things can be very powerful. But the point is that the turbo laser cap, that's the one I showed you, is the most powerful low-level laser for hair growth on the market. It's packed completely flat for travel. We've used it in thousands of patients. It's the most popular device in the practice, and we've used them all. We started out with huge lasers that would fit on the floor. Essentially, you would sit under. Patients would come in 3 times a week for those therapeutic interventions and those treatments in my old office. And then we progressed to smaller devices, portable devices, handheld devices, and then, of course, the laser cap invented by Dr. Michael Rabin in Cleveland, Ohio. And I worked together with him and his scientists to create that turbo laser cap that I showed you. So that's the one that we recommend. The other
Okay, that's
ones,
great. It's
so
good to
like, look, if you
know.
think of
It's good to know that
think about
quality is
China,
very important in this field rather
I mean,
than just getting a
it's
cheap knockoff.
electronic devices are. It's pretty clear. Electronic devices, you get what you pay for. Like when you go to Best Buy, the difference between $100 TV and $1,000
Right.
TV. And a
Right.
$3,000 TV. It's not mystery, right? You can
Right.
see the difference. It's the number of pixels, the size of the screen, the features and the benefits. And that's how electronics work. You're going
That's
to
a good
you're going to pay a little
comparison.
bit
Yeah.
more. Yeah, you're going to pay a little bit more, but hopefully a device like the turbo laser cap is going to last you forever. So that could be your least costly treatment over time.
So that's great. Let's move on to something that I do. So I saw this small trial. It was like a pilot trial, I think, that showed that if you use topical finasteride, so a tenth of the dosage, it basically has a similar effect as the full dosage that is usually recommended. I think they're recommending 1 milligrams of topical finasteride, but if you take like a tenth of a milligram, 100 micrograms, I think it was something about that. I read it a while ago, but it was like it had a similar effect. Is there any truth to that, or what's your opinion on that?
I think you might be confusing the oral dosing strategy. So many years ago, in 1998, when the FDA approved finasteride under the name Propecia as a hair growth drug, it had already been pre-approved as a 5 milligram dose for prostate. And to try to figure out what would be the right dose for hair loss, what they did is a dosing study. And this is not uncommon in the world of big pharma. They'll use 1/1000th of a milligram, 100th of a milligram, a tenth of a milligram, 1 milligram, 10, 20, 100, whatever, and so forth, right? And they try to figure out from that dosing curve where they would have the biggest biologic effect and also the biggest clinical effect. And so while it is true that if you took a tenth of a dose of finasteride, let's say zero point 0.1 orally, yes, you can lower the DHT level in your body. But the problem was that it didn't have as much of an effect on the hair follicle, let's say a 1 milligram dose.
Mhm.
Now, many of my patients have been with me since the 1990s, and they still take a 5 milligram dose because they got started on the ProScar dose before the FDA approval.
Okay.
And it's amazing. A huge portion of them, they've never ever had or complained of a side effect. And even if you talk to urologists who use 5 milligram dosing strategy for prostate enlargement, it's amazing how well those patients do on that dose, even though theoretically you should have a little bit of a higher side effect risk. Very unusual. But that having been said, I think your question was, so do some of our patients titrate down their dose from 5 or 1 down to a half or days with their dosing strategy? Of course. But we do know that if you go lower than 1 milligram a day orally, that can impact the efficacy, right? But if you have side
Okay.
effects and you want to decrease the side effects, you may want to try a different dosing strategy. You may want to try a different time of the day. You may want to skip days or use less per day, that type of thing. But I
Why
think what
would
you're
somebody
asking,
who Yeah, no, but let's say I started doing topical finasteride after I saw a
yeah,
study that showing that it had equal efficacy with much lower decrease in DHT, maybe a 30% decline instead of a 70% decline. And
you
then
mean
I
you're talking
saw
about in the serum?
in the serum, correct. Topical finasteride, it still gets absorbed. The way that finasteride works, Propecia, is that even if a small amount gets absorbed, it still can inhibit DHT. And even topical inhibited DHT by 30%. However, it wasn't 70%, and that is a big difference, and it had the similar efficacy. So I just said, you know what? I'm not going to take it internally. Let me take it topically. Later
Mhm.
on, I saw something that said that even a smaller dose topically, and again, I'll recheck that to make sure I wasn't confused, but basically, a smaller dose topically had a similar effect than the larger dose topically, the 1 milligram. But my question is, why
Yeah.
isn't
So
everybody
when we
using
use topicals,
topical?
Joe,
Yeah,
yeah. So first of all, topical medication, remember, is measured in percentages. So it could be 0.25%, it could be 1%,
that's true.
and that
Yeah,
doesn't necessarily equate to the milligram dosing of an oral
correct. Yeah.
medication because it's absorbed differently. But what we do know, just clinically, having treated thousands of patients with topical finasteride, it's a very popular treatment option, very often combined with minoxidil in the same solution or not, is that you can get a very powerful effect. And I think that's what the research shows is that even topical finasteride can have a very strong effect on hair growth and hopefully mitigate or reduce sexual side effects in patients. And exactly what you said, probably a little bit less is getting absorbed into the system. But remember that DHT, dihydrotestosterone, is also produced at the level of the follicle. So treating that area right away with finasteride or even dutasteride can have a very strong effect on hair regrowth. We do often use that. Now, some patients will use oral finasteride and topical finasteride together. And so people say, isn't that redundant? And maybe not. If you're not so good at being compliant or adherent to topical medications, and applying it orally can also be helpful. So, for example, even just minoxidil. We prescribe minoxidil in a compounded format called Formula 82M. Obviously, if you add finasteride to that, it's called Formula 82F, the combo. You have to do it twice a day, every day, because it contains minoxidil, which has a short half life. But let's just say you're not doing that's 14 times a week. You should be applying the medication. Let's say you're only doing it once a day. That's 7 days. Let's say you skip the weekends. Now you're down to 5. So you're 5 out of 14 treatments. That's a failing grade. A lot of our patients will supplement their topical application with an oral version, and they can use oral finasteride or they can use oral minoxidil. And that's been a
Well,
game changer for patients.
okay, let's say somebody is good about it, right? Let's say they do it consistently.
You're
Why
disciplined. You're doing it twice a day, every day.
you're doing it twice a day, you're disciplined. Is there any additional benefit? Why would somebody not, if you look at the cost benefit, the side effect
Mhm.
profile, more significant in the internally, right?
Sure.
Why wouldn't everybody who's disciplined? Why wouldn't everybody who's disciplined do the topical one?
Yeah. The reason is because double blind randomized clinical trials do not elucidate the N of one. And what I mean by N of one is the individual effect that medications or treatments are going to have based on either your DNA or your lifestyle or other habits, even your scalp microbiome, the microbes that are living on your scalp and the amount of sebum that you have could affect how much of that medication is getting through or not. And there's no one size fits all. And it's really nice. It seems really nice. And my colleagues and I often get caught in this. We're like, "Oh, we have 1,000 patients and this definitively shows that the topical works better than da 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 or whatever." But what it doesn't elucidate is that patient who is doing the topicals, but has other issues that are going on that we then found out later that really inhibited the hair growth.
Okay.
So that's why, if we're really trying to mitigate DHT as the trigger for hair loss, in some cases, we got to be very aggressive. And that would be oral and topical, or higher dosages, or the dutasteride regimen, off label.
Okay. And where does microneedling fit in? There's a lot of good early evidence for that. Where do you see that fits in?
I love talking about microneedling because it seems so great. Like you just do it at home and you're good, right?
Right.
The problem is that microneedling has a huge variety of definitions, right? So when people say, "Hey, doc, do you recommend microneedling?" I said, "Well, yeah, I use microneedling like every time we do a standalone PR." The device that I use in the operation room, literally in the procedure room, is very different than that derma roller that you bought from China on Amazon.
Okay.
It is not the same. It
Well,
is
some of
not a
them are
Dr.
not
Pen,
rollers. Some the
a Dr.
pens.
Pen. Yeah.
Yeah.
A Dr. Pen that you're running across your scalp at God knows what kind of speed or sterility that thing is providing. It's a very different device. Dr. Pen is probably like maybe $100, right? On Amazon.
Right. Yeah.
The devices that we use in the operatory, it's a $10,000, like finely tuned German microneedling tool. It's like the exact opposite. It's like a difference between a go-kart and a race car. They couldn't be farther away on the spectrum of therapy. And so probably the disposable that we use, which is the little tip that's hermetically sealed and different separated from the tool end of it, right? That little disposable tip is so sophisticated. That little tip probably costs almost as much as a Dr. Pen.
Mhm.
That would be like using a Dr. Pen and then throwing it away every time.
Okay.
Do you understand? So there's a huge difference. So what would be the purpose of microneedling? There's a few things that microneedling can do for you. Number one, if you do it, let's say gently, little tiny punctures in the scalp, that would be good for enhancing the penetration of treatments. So treatments could be peptides, copper peptide, thymosin beta 4 derivatives, VEGF. These are peptide treatments that you can apply to the scalp, right? And growth factors. You're also going to enhance the penetration of minoxidil and finasteride or dutasteride, whatever you're applying up there. It sounds really good because you're bypassing the stratum corneum, which is that moisture barrier. You're making a little hole in it, essentially, maybe even a lot of little holes, and you're getting a very deep dive, if you will, in terms of those growth factors and serums or medications and pharmaceuticals. So that's great. If you're doing it with a procedure like platelet-rich plasma, the purpose of the microneedling as a finishing step is not to get something in through the skin, but actually to trigger a little bit of micro trauma. And I think that most of us biohackers understand that a little bit of hormesis, hormetic stress, if you will, has a powerful effect in many areas of the body, and the skin is one of them. If you create a little bit of micro wounding, I'm not talking about like you're trying to resurface your scalp with that Dr. Pen. I'm talking about a little bit of triggering of blood flow and a little bit of wounding that's microscopic. You can actually create a surge of growth factors endogenously in the body, which can then stimulate hair regrowth. And so that's a really nice effect. So those are all the beautiful things that you can do with the microneedling as a tool and treatment in the office. And if you're doing it carefully at home, you could get a similar response. But what I found is that people are still using the same derma roller or the same derma pen that they bought a year ago. And I just know that it's almost impossible to clean those sterilely.
Very
How deep
difficult.
they're going, how deep
Yeah.
they're going into the scalp varies immensely. And everybody's scalp is a little bit different. If you've been on, let's say you're a 50-year-old guy and you've been on testosterone, your skin might be thicker. If you're a 50-year-old woman, your skin might be thinner. And so you have to titrate and adjust the microneedling tool to the collagen layer of the skin and also what you're trying to do, what the effect is. I think a lot of people can get into trouble with microneedling because they're so readily available now. You can buy the cartridges, you can buy the Dr. Pen, you can buy the derma rollers. We prescribe and dispense a microneedling kit. It's called the Preppy Suite, and it's gold plated, so it's easier to sterilize. It creates less tissue reaction at the level of the skin. It's very different than the titanium needles, which are very rough that you would typically see. But we prescribe very sparingly and with a huge amount of instruction. Don't screw this up because think
Right.
about this, if you create too much trauma and too much inflammation at the level of the scalp, what do you think is going to happen to those hair follicles?
Not, they're
What's
not going to grow
You're going
very
to
well.
replace those. Not only are they not going to grow, but you're going to end up replacing those follicles with scar tissue. And if you do that, guess what? You need a hair transplant.
Okay. What about
That's not a good plan.
scalp massaging or combing? That's something I've seen online that some people get really good results by basically massaging their scalp, trying to make it as flexible as possible, and that seems to have a very good effect on hair regrowth.
So, yeah, what's interesting is that even today, and of course, it was like almost like a wives' tale, right? That, oh, you just massage your scalp and your hair will grow better. And so I'm not convinced that's going to be a miracle cure for people. But here's the thing, there are some scientific studies that show that the signal, remember we talked about cells, signals, and scaffolds as regenerative medicine technology? The stretching of the skin is actually a mechanical signal. And there are studies that show that mechanical signals like stretching, they do impact hair follicle function. So it's not so much an old wives' tale anymore. I just don't think that's going to be a miracle cure for the vast majority of folks. We do offer scalp treatments, therapeutic scalp treatments in the office. In fact, I have an entire department that's geared around my certified trichologist and hair coach, Kimberly. She's amazing because there's so much inflammation and dysregulation at the level of the scalp from the different shampoos and toxins that are out there and lifestyle factors. And sometimes we need to actually apply a therapeutic regimen using a scalp massage and a scalp treatment. And I will tell you, there is no better stress release than a 60 or 90-minute scalp treatment in my office at Bauman Medical. It is at the very least, you're going to be in la land after 90 minutes of scalp treatment. Hands down, no question. You will not be
Right.
able to, you're going to be like Joe Biden in the debate. You're not going to be able to speak after that.
I love the scalp treatments. Okay, so Joe Biden in the debate, that was funny. Okay, what do you think about a ketoconazole shampoo?
Ketoconazole, very popular out there in social media land. Ketoconazole is actually an antifungal treatment. So why would ketoconazole do anything for the scalp? So it has two functions, right? It can improve scalp health, meaning if you decrease that production of, let's say, fungus, malassezia in particular, which is the main trigger for seborrheic dermatitis, if you can control that microbiome and improve the diversity of the microbiome of the scalp, you'll have less inflammation. And ketoconazole is really its main function was as an antifungal treatment. As you mentioned, it also has a mild anti-androgen effect as well. And this just happened to have been a side effect of the antifungal treatment. And so because we know DHT, dihydrotestosterone, is the main trigger, main androgen responsible for male pattern hair loss and some female pattern hair loss, ketoconazole sounds like a great idea for shampoo. But there are some huge downsides to using ketoconazole shampoo. Have you tried it yourself?
I do. I've been using it for a year.
Yeah. Have you noticed that when you use ketoconazole shampoo that your hair feels a little bit different?
Not really, no.
So
It could be that's the case. Who I put other stuff on my hair, like, it would be very difficult for me to tell that.
so what I notice, and I've tried it myself, is that when I use ketoconazole shampoo, my hair turns to a big ball of hay. It feels so dry. And maybe it's because you're much younger than I am. I don't know.
I'm also
But my
putting on things after that
okay.
moisturize the hair and stuff,
Yeah,
so
yeah,
it's
yeah.
hard to know.
No, that's super smart. And I was going to get to that. What do we do about that situation? So ketoconazole can strip the scalp of moisture, the sebum, the oils. It can strip the hair of moisture, again, the sebum and the oils that moisturize the hair and keep the aesthetic value of the hair. And for many people, they cannot tolerate ketoconazole shampoo. It's just so harsh as a detergent agent that simply it removes, even if it has a great hair growth effect, it removes all the aesthetic value. And so when I recommend ketoconazole, as you have indicated, you must follow that with a deep conditioning treatment of the skin and the scalp, as well as of the hair at the same time.
Mhm.
I don't think that ketoconazole antifungal and anti-DHT properties are anything miraculous. I don't think they can hurt you chemically. I just think that it's really impacting the aesthetic value of the hair. And the other factor is that most people don't leave it on long enough to create the effect of the ketoconazole in through the hair follicle absorption pathway. If you're just shampooing it in and rinsing it out, you actually just all you got was the side. You didn't even get the benefit of it. So you have
How
to leave
long
it
do
in
you need
there
to
at least
keep it in
6
for?
minutes.
Oh, 6
Yeah,
minutes.
I would
Okay,
say
I
6
keep
to
it in
10
for
minutes.
I was gonna say I keep it in for 5 to 10 minutes. So it's
That's
the
pretty
first
good.
thing I put on in the shower, and then I just leave it on until the end, and then I
Yeah.
wash it off. That's like
Yeah.
my
So you don't
protocol.
even follow with a conditioner in the shower. You condition afterward as a styler.
Yeah, because my hair is naturally pretty oily, so
Okay.
I find that I don't need conditioner at all, and then I'll put on some things
Nice.
after, mainly like certain oils, and that's actually what I wanted to ask you about. I'll put on like rosemary essential oil, a little bit of peppermint, a little bit of lavender essential oil. Do those things help with hair loss, or they have some very small trials, I think, or
Yeah.
maybe it's
I mean, the
animal
rosemary
only. I don't
oil,
remember.
you know, all of that stuff on your scalp, man, it's gonna smell like a Christmas tree after a while.
I do.
So here's the thing. Rosemary oil is taking the internet by storm, right? Because there's one small clinical trial, underpowered, some really crappy science that every Instagram
100%.
influencer thinks that they discovered the effect of rosemary oil. And look, I'm not going to poo essential oils because there are biologic effects. Some of these essential oils have estrogenic effects, as you probably know. These
Right.
plant estrogens can be very powerful and they can have an impact on the skin and also systemically as well. So, could rosemary oil actually work like minoxidil? I've yet to see it. Again, I've read the studies. I know what it says. I think maybe it has to do with the dosing strategy, how much gets absorbed. If you have an oily scalp to begin with, should you clean off that oil and then put the rosemary on? What is the source of the rosemary oil? How was it extracted? Anybody that, and I'm not an expert in, say, traditional Chinese medicine, but a traditional Chinese medicine pharmacist will tell you that you could have the same root. And if you extract the components this way, it has this biologic effect. And if you extract the components this way, it has a detrimental effect. And if you extract it this way, it has a completely different biologic. Just rosemary by itself doesn't tell me the story about how it's going to work or even where
Well,
to make
most of
sure that
them,
what I'm getting.
yeah, the essential oils I think are mostly more or less they're not too different, right? They smell pretty similar. The quality
Well,
could different, but
I'll tell
what
you,
yeah. Yeah.
here's the thing about essential oils. It's very clear that, and I happen to do a deep tissue massage. I get a deep tissue massage by a therapist just to keep my body in action because I operate many hours each day. So I have a kind of a standing appointment to keep my back and shoulders and neck functioning properly. And I will tell you that sometimes she'll give me some of the essential oil to go home with. But I know within a certain period of time, it doesn't smell the same. It doesn't have the same biologic effect. I can tell the difference. So these essential oils can oxidize and they can produce toxins actually that are detrimental to your
Mm.
skin and to your body. And we may not necessarily know genetically, are you susceptible to that? And if your rosemary oil is 2 weeks old or 4 weeks old or 2 months old, or it's been sitting on a shelf at Amazon warehouse for a year before they send it to you, how do you even know what the quality is? You could just be throwing some massive toxin right on the top of your scalp and you wouldn't even know it. Look it up.
Okay.
You'll find it. That's why clean beauty is like a thing, right? These essential oils, which are replacing parfum, right? They're replacing fragrances in these shampoos and conditioners and skin creams and so forth. Like now there's going to be you'll see a huge backlash because all of these essential oils that have replaced the synthetic ones are becoming oxidized in the bottle, but without the preservatives, and they're creating massive inflammation on the skin.
Mm.
Just be aware, it's not a simple thing.
Okay.
Putting something on your skin, it's getting absorbed, and you want to know what it is. Just like when you put a capsule in your mouth, where did that come from? You don't want to be taking a vitamin that you bought off of Amazon. God knows
Does
how long it's been
minoxidil
stored somewhere.
does minoxidil or finasteride get degraded or oxidized over time, or it's pretty shelf stable?
Our prescription minoxidil and finasteride compounds have a very short shelf life.
Oh, seriously?
Yeah, absolutely. And I wish it was
Happens
different.
what happens if it's after the shelf life?
That's who knows, depending on how it's been stored and moisture exposure and light exposure and things like that. But these are compounded medications that have a specific born on date. It's born the minute that we call in the prescription, they start to make it specifically for you. And if you stored it in your bathroom and it's like steam shower in there or whatever, the moisture is totally different than if you kept it like in the kitchen in a cool, dry place.
What
So,
would happen?
you
It
know,
could it be harmful or it could just be like not as strong?
that's a great question. I don't know. Maybe that's a good question for ChatGPT, but I'm sure ChatGPT would tell you that it could degrade and be less powerful. It could
Okay.
turn into something else that doesn't work as well, or could actually be harmful to the scalp. These products degrade over time, especially the quality compounded ones. They are not designed to be shelf stable. No way. This is
That's
not
interesting.
your father's Rogaine bottle on the shelf, which is just the nastiest stuff and probably least effective treatment ever in the history of the world.
Okay. What about topical things like topical ATP, caffeine, carnitine, alpha ketoglutarate, aloe vera? What's your
Yeah. So
opinion on it?
I'm keen on some additive ingredients. The shampoo line that I helped create that we have under the Bauman brand has caffeine, green tea, saw palmetto. It has Scalp. It has a number of other ingredients in there, which have been proven in scientific literature to have a biologic effect. I'm a firm believer in some of those things. Can you apply ATP to the skin? I'm not so sure about that. I think if you want to increase your ATP production, you've got to talk to the mitochondria about it. And in order to do that, you got to hit it with red light. That's really the ATP producing agent. The only exception to that is a liquid that we use in conjunction with hypothermosol with hair transplantation called ATPV. And that's a liquid that goes into the storage solution that helps transmit ATP into the cells that are sitting outside the body, separated from their blood supply and so forth, and
Mhm.
nutrient supply.
Okay.
Yeah.
Interesting. What about so let's talk about some of the internal factors. You mentioned metabolic issues are gonna lead to hair loss. What are some of the other internal factors that are gonna lead to hair loss?
Yeah. So your
Holistic.
nutritional status. Yeah. Your nutritional status is critical, right? So we know the hair follicle, just as we've talked here for, let's say, about an hour, your head of hair, if it had 100,000, 150, 100 to 150,000 hair follicles, which about 85% of them are in the growing phase, those 85% of the 150,000 have already produced about 6 feet of hair. If you've listened this far. So there's that. What does that mean? That means that there's a highly metabolic cell population within the hair follicle, and that's probably why it's so sensitive to metabolic dysregulation. And so, how do we know that? It's really simple. Years ago, when bariatric surgery, stomach stapling, and gastric bypass came on the scene, we saw patients lose tens of pounds, hundreds of pounds sometimes. And man, they came in with gobs of hair in their drain. What they became immediately nutrient deficient. And the first thing that they saw in the mirror or in the drain was their hair falling out. And my background is general surgery. I'm very familiar with how bariatric surgery works and the nutritional depletion that occurs immediately. This may be less of an impact today because the nutritionists kind of got on board with that pretty quick. But still, when you lose a lot of weight or you're nutritionally dysregulated, boom, you malabsorption, whatever, you can certainly have a hair follicle effect from that. And so that's just the sheer metabolic commitment that your body makes to producing this little tiny hair fiber that we call the hair. The
What are some of
dermapapilla
the
is the
main
site of the.
factors? Like protein, amino acids, iron, B
Ah,
vitamins.
yep,
What
you're
else is
hitting them
there?
all. You're hitting them all. So
Okay.
vitamins and minerals for sure. Protein is probably the most important factor because we see the vegans, the vegetarians, they're not tracking their protein intake, or they have poor sources of protein. They're not maintaining enough protein intake to actually grow hair. And so if you just looked across the population of patients, I can almost spot them from across the room. But there's thyroid hair and then there's vegan hair. And it's like, ooh, it's just like straggly and weak and low density. It's just crappy hair.
Vegan.
And the longer they've been vegan, the worse their hair is, honestly. You know, when vegans tell it, and look, I'm not an expert on nutrition. Of course, I know what I know from not just medical school, but going to conferences and learning about the cell populations like the hair follicle and the required nutrients that are needed. Literally, to create 1 gram of hair, which is about as much hair would fit into a sugar packet, you'd have to do calisthenics for 20 minutes, like vigorous, like jumping jacks. That's a lot of energy to create like 1 little gram of hair. But
Oh
anyway, the
wow.
point is that if you're metabolically deficient, and so my point was is that the energy that those vegans and vegetarians feel when they go strict vegan, you know what that is, right? That's their body telling them that they're hungry. You got to go find some food.
That's okay.
But anyway, yeah. So, a lot of those folks, we'll put them on veggie protein powders and things like that. Obviously, the collagen powders today are bovine collagen. They're not going to want to do that. But we try to encourage them through a functional medicine department to maybe rethink some of their nutritional choices if they want to grow good hair. You
Do you
mentioned
find that
vitamins
it's
and
more
minerals.
from so I've seen this a lot, like, vegans will come to me, "Hey, I'm losing my hair." I'm like they find out that they don't eat enough meat, whatever, I say, "Okay."
Hmm. Hmm.
Usually, they're protein deficient and iron deficient. Have you noticed which one is more, like the amino acids or the iron?
Cool. They're both detrimental for sure. So
Right.
oftentimes we see women who are still childbearing age and they have heavy periods and so forth, and they're anemic, literally. You can see it almost in the whites of their eyes, as they say, that they're anemic. We do the testing, we figure out they could be just mildly low in ferritin, or they're truly like severely anemic, and many of them need other therapeutic intervention to build back that iron level. And of
Right.
course, for your listeners, obviously, and your followers, they know iron is what carries the oxygen. So if you're deficient in protein, okay, then you don't have enough wood for the fire. And if you're deficient in oxygen, you don't have enough oxygen for the fire. It's like, how are you going to build a campfire there? How are you going to cook a pool, some food? You're not.
Right.
So it's like you're depleted in the really critical things to make metabolism happen.
And then there's zinc as well. What other nutrients are involved in hair loss?
There's a lot of nutrients, obviously. And one of the things that I did was I took like some of the main ones, especially B complex. B7 is obviously biotin, that's part of it. B12. We put those really good quality and top level nutrients into a product called A-List, which is my multivitamin specifically for
Mhm.
hair. And so that's really the best thing if you're not already taking a vitamin, you should look at that. And that's a great stopgap, especially for young guys who maybe never took a vitamin before, but they noticed some hair loss happening. That's a good thing to start with. And so we often pair that with, let's say, a probiotic to improve their gut metabolism, to make sure whole body inflammation is down. And you could also pair it with the collagen protein powders, which are specifically geared for hair regrowth. Those are some of just the main things that we do. I do also send, I like riboflavin. I do a couple of things that we even mix with our minoxidil, with the finasteride, to make sure patients are getting good nutritionals at the same time they're taking their pharmaceutical treatments too.
Okay, my last question is, do you think hair loss could be postponed until you're like 100 with the right treatments? What's the limit?
Yeah, I don't think there's any limit. I think that you just have to take action early enough. In today's world, unfortunately, and if you're a guy, you really like your finger has to be falling off before you go to the like. So sometimes we wait too long and we want to be a little bit more proactive. But I do believe that I've seen many patients today, right? These are second or even third generation patients after being in practice for almost 30 years. Those patients that come early enough, they may never ever need a hair transplant. And so they're at high risk, but they're on therapy. They're being monitored literally every 90 days with hair check measurements. And we're making sure that we're maintaining or enhancing their hair growth over time. But if you've missed the boat on that and you feel like you're trying to play catch up, I do have some good news. In this day and age today, we are banking hair follicle stem cells. And that's a new service offering, a new feature of the practice. We could take literally the biological material from dozens and dozens of hair follicles from your scalp, send it off for cryopreservation into a tissue bank. And you've now frozen in time your young, biologically viable, healthy hair follicles. And so in the short term, maybe we'll get some kind of autologous therapeutic intervention, some exosome therapy treatment from that, potentially, or autologous exosome therapy, I should say.
Is that
And
available
then
today in terms of the treatment or just the banking?
no, that's coming. That therapeutic intervention, the topical exosome product derived from your own cells is available. Now, they're limited enrollment because we're starting clinical trial work on that, pilot studies essentially,
Hmm.
to fine tune that. But yes, that is available at Bauman Medical. We do have it. By the time this podcast gets out, that stuff will be underway. And then in the long run, now you're going to have those stem cells on ice. So when hair follicle cloning becomes available, and I know that it will eventually,
How
you'll
long do you
have some of
think?
the younger cells. That's always a gift, right? If you talk to the scientists, they always say 5 to 10 years. I talked to somebody last week. They said, "Oh, we're going to have it in 3 years because of AI." And I think that's optimistic. I think we'll get a breakthrough in that technology in about 3 years. But of course, it's going to have to work its way through the system in terms of FDA approval and safety and efficacy over time. But I'm a bit of a Star Trek fan. I just know that it's coming. We're going to get it. It's just a matter of time. I think between 5 and 10 years, we're going to have some kind of strong therapeutic hair follicle cloning breakthrough and an application in humans for sure.
And when that happens, that's basically going to solve the hair loss issue. You're not going to need to do low-level laser therapy, all these other things, rosemary oil.
You toss out your rosemary oil if you need hair follicle cloning. But here's the thing: even though we have these regenerative treatments or that they're coming, a lot of people may be slow to the game, or they may have lost a lot of hair previously, so they'll need those kinds of therapies. And look, those therapies are not going to be cheap out of the gate.
Right.
I
No,
mean,
but if it's the
I mean,
cloning,
even today.
you're saying if it's the hair follicle cloning, it's still not going to work if you lost hair already?
No, it will work. I'm just saying it's not going to
Right.
be inexpensive. These folks who
Oh,
are
okay.
investing millions or billions of dollars into hair follicle multiplication, they're going to want to get their investment back out of it. The first people that get a cloned head of hair, first of all, it's probably going to look a little crazy depending on who does the implantation. But that's just how it is with technology, right? The first electric cars, the first whatever. The stuff is expensive when it rolls
All
out.
right.
And then
That's
hopefully it gets less expensive as we go along.
that's what I've been waiting for, these clones. Just get rid of them
Cloned
all.
hair follicles.
Yeah.
Attack of the clones. During
Exactly.
your hair transplant, your doctor didn't offer you hair follicle stem cell banking?
No, they didn't.
Oh, man, next time you're in South Florida, come on down and we'll bank some
I'll s
follicles for you, Joe.
I'll stop at the real clinic here, the legit clinic. Yeah, I'll stop by the next time I'm in Florida.
That would be great.
All
We
right.
could do some hair measurements. We could look at your old transplants. We could fine tune your regimen, do the DNA test. We can apply some growth factors with TED, make it very relaxing. You could do a scalp therapy treatment with a scalp makeover team, that relaxing, stress reducing, do good, feel good treatment. You can enjoy it all. We'll just rotate you right around all the different departments.
That would be amazing. I would love All right, awesome. Thanks for coming on the show. I really appreciate it.
Joe, listen, it's
I'm
truly been my pleasure. I guess the take home message for your all of your listeners, I think, should be that if they are struggling with hair loss out there, don't panic. Get a handle on it. Get an evaluation by a board certified hair restoration physician. Whether you're in the early stage of hair loss or you feel like you're in the middle or even the late stage, there are a lot of effective treatments. We covered a lot. And if you have any questions, you can always reach out to me at baumanmedical.com. That's the location where you're going to find thousands of pages of information on all the therapies and treatments we talked about today and many more that we didn't get a chance to chat about. And even if you just have a simple question, you can go to baumanmedical.com/ask, AFK, and just ask me a question, and I promise I'll get back to you. Or start a consultation and evaluation, whether it be online from your home or phone, or come into the office, visit us in Boca Raton, Florida. It would be my pleasure to try to help and for you.
All right, awesome. Thanks for coming on. I think you've been enlightening in a lot of ways. I've been doing my own dilettante hair loss prevention treatments, and it's very interesting to get your perspective on what I might be able to do better. So great having you. Thanks for coming on.
It's really my pleasure, Joe. Great to be here with you.
67% of listeners aren't subscribed to the show, so please don't forget to show your support by hitting the subscribe button now. You'll not only be supporting the show, but also investing in yourself and your health journey, all while helping to keep us ad-free.